Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
My name is Anush. I'm 18 years old and I'm from Burbank, California. I recently graduated from high school in Burbank and I will be enrolling in college in fall. I am here today to see Dr. Kassabian because I have a couple of concerns. First about my nose and second about my ears. Well, my nose is crooked because I fell on it when I was young, so I would like to fix that up. Also, I want my ears to be pulled back a little bit. A family member recommended Dr. Kassabian to me. I've seen several people who did surgery at Dr. Kassabian's office and they all looked great. The results were very good. I think it's the perfect time to do the surgery now so that I can start a new fresh start with college and with my appearance and my look. I will feel more confident, more beautiful, and I want to meet Dr. Kassabian to see how he can help me.
Today I'm meeting with Anush. She has some concerns about her nose, both cosmetic and as well as breathing. She also wants to discuss some concerns about her ears. So let's meet her.
Hi Anush, how are you today?
Great, how are you?
Good, my name is Siobhan. I'm one of the doctor's nurses. I'm meeting with you before he actually comes in and speaks to you. So what brings you in today?
Well, I came because of my nose and my ears.
Okay.
I want to fix them.
So what's bothering you about your nose?
Nose, when I was around 5, I fell on my nose, so it's crooked. It's broken. Yeah.
Okay, so you had an injury when you were 5, and you have a crooked nose. Okay. Do you have any problems breathing?
Yeah, at night.
Okay.
I have a difficulty.
Both nostrils?
Yes.
What do you want to accomplish with your nose besides fixing the breathing and bringing it more straight?
Well, I want it not to look fake. I want a natural looking nose.
Okay. Well, the good thing about Dr. Kassabian is that he's just going to make it look better and not make it look like it doesn't belong to you. Okay, Anush, so what's bothering you about your ears?
Well, I researched online and I found out that we can actually pin a little bit back my ears. So I want to research that. I want to see what we can do about my ears.
Okay, Anush, well let me review your chart with Dr. Kassabian and I'll have him come right in to finish your consultation.
Okay.
Alright. Okay, Anush, let me introduce you to Dr. Kassabian. And go ahead and tell him your concerns and he'll take it from here.
Hi Anush, how are you?
Hi, how are you?
Good, nice meeting you.
Nice to meet you too.
Well, I reviewed your chart with Siobhan, and let me go into further details about your concerns. Tell me what's bothering you.
Well, when I was a child, I hit my nose. I fell and I hit my nose, and because of that, I have right now this bump, and I have difficulty breathing on both sides.
Okay.
Yeah.
Okay.
And also my ears, I want them a little bit pinned back.
Okay.
Because
Okay. I see what you're talking about. All right. So, well, first I want to examine you. Take a look inside in your airways. See what's the status of your septum and your turbinates, okay? And next we'll take some photos and we'll discuss them.
All right.
Deep breath in, out. Okay, good. So a few issues with your nose there's a bump here, okay? At the same time, there's a deviation. From the outside, the crookedness looks like a C. And that's because this area, the bone is sticking out, this side is caving in, and the tip is going this way. Same time, you have a deviation of the septum, the cartilage that divides your right from the left nostril. That's blocking your right airway, and then the left airway, the turbinate, that's the filter that humidifies the air in your nostrils, that's become enlarged, okay? And that's why it's difficult breathing on the left side. So on the left side, you've got the turbinate that's enlarged. On the right side, you've got the septum that's deviated, that's blocking it. So both of them are going to be fixed at the time of the surgery. The bump will be shaved, and then make the nose as soft as possible. All right? Okay. And then as far as the ears are concerned, two issues here is here this fold, it's called the anti-helix. The helix is this rim outside, the anti-helix is this fold. This is not fully formed, so I'm gonna form that and with the help of sutures give it shape. And then here, this part that's called the conchal bowl, this part that's sticking out, that part I'll slide it in. If it looks great, fine. If I need to remove a little bit of cartilage, I'll go ahead and do that. All right, so both of them can be done together. It's gonna take about 3 hours to do both procedures. Okay, one recovery within a week, you'll be all good.
Okay.
All right, any additional questions for me?
Oh, no.
All right, well, if you have no further questions, I'll have one of the patient coordinators help you with the paperwork and go over more details with you. And then I'll see you the day of the surgery.
Okay.
Okay, so nice to meet you.
Nice to meet you too. Thank you. The consultation with Dr. Kassabian went very well. He is going to do a rhinoplasty for my nose to fix the crookedness and for me to breathe better. And also he's going to pin back my ears a little bit so I can wear earrings and feel more comfortable with myself. I'm very happy and I'm very excited.
I just met with Anush. She has a few concerns. One, her nose. She has a breathing difficulty, and that's due to crooked septum, a deviated septum, that I will fix at the time of her nose job. And at the same time, her turbinates are enlarged. Those are going to be shrunk down so that her breathing passages are better. And from the outside of her nose, cosmetically, I'm going to shave the hump and also make it less wide and the tips softer. So that will give her a good looking nose where she can breathe better. Second, her ears are of concern. She has prominent ears and also the folds are underdeveloped. That means the fold that comes on the side of the ear has not developed fully. So what I'll do at the time of surgery is recreate the fold that she's supposed to have on both sides, and then also, in order to make it less prominent, the what's called the conchal bowl, the round part of the ear, slide it inward. If that's not enough, then I'm going to need to shave a little bit of the cartilage in order to make the ear smaller. The ear surgery has two parts of it, especially in Anush's case. On both sides, she's going to have the fold recreated, and that's done by shaving, like rasping the cartilage. And second, the big bowl that's making the ear prominent, that's going to be sliding inward. So that's done either by sliding, or if it's too big, if it doesn't, it still looks big at the end of the procedure, then I'll take a little bit of the cartilage out to make the ear look smaller. So both procedures, it's complementary in a way that they're gonna make her face look better and make Anush more confident about herself.
Allergies that you know?
No.
No allergies? When was the last time you had something to eat or drink?
Yesterday at around 8.
Okay. Nothing to drink after that?
No.
Okay. And do you have anything on your teeth? Veneers?
No.
No? Nothing. Alright. And you don't smoke, right?
No.
And this is the first time you're having surgery?
Yes.
Okay. Do you take any medication?
No.
No medication.
So today's the day of the surgery and I'm very excited. I want to see how all this is going to come out, and I'm very happy to be here today. I'm very happy that I came here for the surgery. I feel very comfortable here at Dr. Kassabian's office, and everyone is so nice to me, and I'm pretty sure it's all going to be great and fantastic.
Good morning, Anush. How are you?
Good.
Alright, so today's your surgery day. Are you ready?
Yes.
Okay. Let me go over the plans. First, the nose. You have a crooked nose, the breathing issues, so we're going to fix the septum. Okay, and the turbinates that are wide, those are the filters on the side, those are going to be made smaller. Then shave the hump and bring the tip up a little bit and make it less wide here. Okay, that's the nose. When you wake up, you're going to have a splint on top and you have packing inside, but you'll be able to breathe through it. Okay, splint comes off in about a week. Okay, the nose, as far as the ear is concerned, first, I have to recreate this fold. This is called the helix. This is called the anti-helix. The anti-helix I have to recreate, and that's done by rasping, softening the cartilage and putting stitches here. Okay, that's going to give you the fold here. And then this area, the bowl, that's the conchal bowl, the round part, okay? That, I'm going to slide it in, okay? If that looks good, great work. Otherwise, I may need to take a little bit of the cartilage out to accommodate if the bowl is too big. Okay, so that the stitches come out in about a week in that area, and we'll have a temporary wrap over it. This will be a little bit uncomfortable in the first couple of days, especially with some swelling, you know. But within a week, you'll be all done. All right. Any questions for me?
No.
Okay. Well, if you have no further questions, we'll go ahead and start.
Okay.
All right, give me a big hug. That's your breakfast.
Okay, I'd like you sleepy now, huh?
Take a deep breath in. Okay. And, relax, happy thoughts. Okay. I think when it's all done, you're gonna look great. Okay. So starting Anush's surgery, first I'm gonna start with the ears. That should take me about an hour. And then move on to the nose. The nose is in two parts. First the breathing, the septum and the turbinate. That needs to be fixed so she can breathe better. Then the cosmetic portion on the outside. Get rid of the hump, make the tip a little bit less projected, and the tip needs to come up a little bit. So all in all, about 2.5 to 3 hours, she should do very well. Just got done with Anusha's ear surgery, otoplasty. Everything's going very well. Next, moving on to the nose. So I'm gonna start with the septum, the breathing part, and then move on to the cosmetic part. So that should take me about 1.5 hours to do. All right. Just got done with Anusha's surgery. The otoplasty, the ear pinning was done first. That took about an hour, and then the nose part took about 1.5 hours. So she's recovering very nicely, and she should heal very well. I will see her in follow-up tomorrow.
So I came here today to meet Dr. Kassabian, and I'm very interested. I want to see what he's going to say about me. I mean, I feel great, confident, and I want to see how I'm healing, and I'm interested to see what he has to say.
Hi Anush.
Hi.
How are you?
Great.
Good. You're healing very well.
Thank you.
You're 1 month out.
Yes.
Yeah. How's your breathing?
It's great.
Yeah.
I mean, ever since I've had this surgery, it's improved, and when I sleep, I can finally, breathe.
Fantastic, fantastic. And you look fantastic too. You look beautiful.
Thank you.
Yeah. Are you hearing comments from your friends and compliments?
Yeah, all the time. Classmates, friends and family, all the time they say I look great.
Fantastic. I'm happy for you. Well, I'm gonna examine you, see how the healing is going on from the inside. Look at your scars, all right? And take some photos after that.
All right.
Okay. Profile, turn this way. Anush, everything's healing very well. Do you have any questions for me?
No, I don't have any questions.
Okay, fantastic. Then I'll see you in a month and we'll check on your progress then. All right?
All right.
I just met with Anush. It's been 1 month since her surgery. Everything's healing very well. I see her nose is fixed with the septoplasty. The rhinoplasty made her nose look beautiful with the bump gone and less wide, the tip softer. And also the ear surgery made a huge difference on her. It complements her features right now and it's in proportions to her face. The cartilage, as we talked about before, was shaped both in the fold and also in the cup area was made smaller. So overall, the ear has the proper folds and also the size of it looks smaller because it's folded in the right direction. So I'm very happy with the results and I'm gonna see her in follow-up in a month.
He boosted up my confidence and now people compliment me all the time. I'm very thankful to Dr. Kassabian for this big gift. My breathing is much better and now I can fall asleep easily. I'm very happy I made this decision. I will never regret this and I'm very, very thankful.